The agencies tasked with overseeing Canada's involvement with the World Health Organization appear to lack information of public interest while sending unelected delegates unprepared to represent the interests of Canadians as a whole. Let's dig in.
The IMB and the IHR working group are operating amid a torrent of fake news, lies, and conspiracy theories. There are those who claim that the pandemic agreement and IHR will cede sovereignty to WHO and give the WHO Secretariat the power to impose lockdowns or vaccine mandates on countries. You know, this is fake news, lies, and conspiracy theories. You know, these claims are completely false. You know that the agreement will give WHO no such powers, because you are writing it.
In 2022, I began filing access to information requests to determine who was behind the messaging and development of talking points as it pertains to Canada's role within global interest groups. In this years-long investigation into the way Canada balances its democratic mandate versus how it adheres to globalist private interest groups like the WHO, the World Health Organization, it should come as no surprise that the Justin Trudeau Liberals are not the beacon of inclusivity and transparency as they claim to be. The access to information response documents that I'm about to share with you were made possible through your generosity and support at rebelinvestigates.com. That's our exclusive accountability journalism website. But before we get into them, let me provide some much needed context in case you've missed our previous reports at exposethewho.com. Now, as I mentioned, the WHO refers to the World Health Organization. It's a globalist health dictatorship that has been working to strengthen its global health surveillance and control mandate since the COVID-19 pandemic. They're doing this through two apparatuses. One, by amending international law through proposed changes or amendments to existing international health regulations. And two, through the development of a new pandemic agreement, accord, or treaty. No one can agree on what to call the thing, but the agreement itself has been up in the air for years. But this isn't what's happening with the IHR. Those international health regulations already exist, and they are already legally binding. The changes or amendments to them have been proposed and rushed through without a quorum or due process. The WHO describes the international health regulations as an overarching legal framework that defines countries' rights and obligations in handling public health events and emergencies that have the potential to cross borders. The cornerstone of the IHR are called public health emergencies of international concern. They're declared at the whim of the WHO's Director General, Tedros Ghebreyesus, who urged member states to utilize psychological operations to gain compliance with COVID-19 restrictions, who adhere first and foremost to their pharmaceutical funders like the Bill and Melinda Gates Foundation and their Global Vaccine Alliance known as Gavi, and recently even called for aggressive pushback on anti-vaxxers who didn't take a rushed to market experimental genetic injection, and obviously subsequently now question the marketing slogan safe and effective.
Serious challenge that's posed by anti-vaxxers, and I think we need to strategize to really push back, because vaccines work, vaccines affect adults, and we have science, evidence on our side. I think it's time to be more aggressive in pushing back on anti-vaxxers. I think they use COVID as an opportunity, and all the havoc they're creating.
Simply coined as IHR, these regulations require countries to set up a national IHR focal point or communications with the WHO and establish and maintain core surveillance and response capacities, including at points of entry, that's borders, and maintain international travel health documents, that's vaccine passports. The WHO may state that all of this is being done while safeguarding travelers' rights and personal data, but if the handling of the COVID-19 pandemic were any indication, all of that can be easily and readily swept aside under the guise of health and the greater good. The strict requirements and centralized control laid out by the globalist health dictatorship at the sole direction of Tedros is concerning for nations said to operate as democracies. Now, by June of 2022, health agents were seeking to refine media lines around the IHR amendments in an email addressed to Lori Hunter. That's the Director General at the Centre of Emergency Preparedness at the Public Health Agency of Canada. We're in the process of updating our media lines on the amendments to the International Health Regulations, and OIA, that's Office of International Affairs, suggested that you and Cindy Evans, she's the vice president at PHAC, should also review and approve the content, since EMB is the technical lead and authority for the IHR in Canada. Side note here, the EMB stands for Emergency Management Branch, but there is nothing publicly available on it except for this link, which directs to a Health Canada initiative offering international health regulation training to the International Health Regulations Policy Team. So this brand new bureaucracy dedicated to ensuring Canada's participation in this global health architecture initiative that no one voted for, but is top-down instituted by the WHO, now exists in plain sight. The email continues, as you probably know, there have been a lot of misinformation and disinformation in the media and on social media regarding the outcomes of the 75th World Health Assembly in regards to the amendments to the IHR. We have received a few media requests on this and have seen quite a bit of discussion on social media as well. We're hoping these lines can help clarify the situation and correct some of that mis and disinformation. As further explained in the emails, these media lines, referred to as ML, were put together for a Public Health Agency of Canada, that's PHAC's spokesperson, attending the CPHA conference, which is a Canadian Public Health Association's yearly conference sponsored almost entirely by pharmaceutical companies. An email request went out again June 14th asking for media lines on Canada's global health strategy. Within the hour, Senior Communications Advisor at Health Canada and PHAC, Lisa Edwards, writes, "Unfortunately, I don't have anything on Canada's global health strategy, but I am the lead on the IHR piece, and that the lines were approved today and are being translated." This was after other communications gurus had nothing tangible to add to the conversation, stating that they don't have any content on this. And this is a tricky one, still looking for lines on Canada's global health strategy and the IHR resolution at the World Health Assembly. Despite clear gaps in government messaging and internal disarray, health agencies accuse those who fact-checked and sourced directly from the WHO of spreading misinformation, showing that those tasked with overseeing this initiative themselves lack understanding of the issues. When targeting the approval date for these media lines, the agency said there is flexibility, but given the mis and disinformation and inquiries coming in, we may want to move through the approvals as quickly as possible. Indeed, those inquiries were coming from me. All of this communication began 3 weeks after I sent a media request to Health Canada asking if Canada would be putting forth proposed amendments to the IHR, and if so, where could Canadians find more about proposals and changes, something they refer to in these documents. The lack of cohesion in knowing how to respond to this straightforward inquiry is confirmed in another email on June 13th, when the health bureaucrats were trying to finalize the media lines wording. Also, would recommend we do not at this time use the words limited in scope. We don't yet know what the overall ambition will be and therefore should not prejudge. Yet the bureaucracy prejudges anyone critical or skeptical of this initiative as spreading mis and disinformation. Part of the media lines confirms Canada's commitment to the WHO and the view that possible amendments should address specific issues, challenges, or gaps that cannot effectively be addressed otherwise, but that are critical to supporting IHR implementation and compliance. They confirm that at the 75th World Health Assembly in 2022, that's the governing body of the WHO that meets each year in May, certain amendments were in fact adopted. After a series of informal discussions, member states came to consensus on the following decisions regarding IHR amendments. Yes, that's right, informal discussions. They reduced the time of entry into force of any future amendments from 24 to 12 months and agreed on a forward negotiation process to consider future amendments to the IHR, which began in the fall of 2022. At this year's World Health Assembly, the Chief Public Health Officer of Canada, Theresa Tam, who no Canadian voted for, committed all 38 million of us to strengthening the WHO's powers through the adoption of IHR amendments and moved to formalize the language around this new pandemic treaty, agreement, or accord.
This week, we will collectively decide on next steps on both the pandemic agreement and on the IHR amendment and negotiations. Canada remains committed to continuing to work together to prevent and minimize the devastating consequences of future global health emergencies and pandemics, and to further advancing health equity for all. A meaningful pandemic agreement is consensus-based and one that member states can sign, ratify, and implement.
On June 1st this year, 2024, the 77th World Health Assembly member states, through a resolution, adopted the package of amendments to the IHR. The 62-page document outlining all of the changes includes an example of an international certificate of vaccination on page 57, specifying a vaccine or prophylaxis that has been approved by the World Health Organization. It also mandates states develop various initiatives to prevent, prepare, and respond to public health emergencies, including developing, strengthening, and maintaining core capacities such as surveillance and risk communication, including addressing mis- and disinformation, and more. For Rebel News, I'm Tamara Ugolini. If you appreciate this report, please consider donating to offset our investigative efforts at rebelinvestigates.com. At that special website, you can also view all of our exclusive accountability journalism and stay up to date on the inner workings of government conduct. That's rebelinvestigates.com. Thanks for your support.